Earlier this year, the DOJ and HHS announced the largest ever healthcare fraud enforcement action. Resulted in charges against 601 defendants across multiple federal districts, picked up 165 doctors, nurses, other licensed medical professionals, all for their alleged participation in fraud schemes involving more than $2 billion in false billings. The cases were coordinated by the Medicare Fraud Strike Force. That's a partnership between the DOJ's criminal division, local U.S. attorneys' offices, the FBI, as well as the OIG. Other federal agencies, as well as state agencies, participated. The prosecutions have a heavy opioid, dangerous narcotics focus. Of those charged, 162, including 76 doctors, were charged for their roles in prescribing and distributing those drugs. Importantly, in addition to targeting schemes of billing Medicare, Medicaid, and TRICARE, the feds also went after folks who focused on billing private insurance companies for medically unnecessary prescription drugs and compounded medications, including those that were never actually purchased or distributed to beneficiaries. The defendants allegedly participated in schemes to submit claims for treatments that were medically unnecessary and often never provided. Patient recruiters, beneficiaries, and other co-conspirators were allegedly paid cash kickbacks in return for supplying beneficiary information to providers so that the providers could then submit fraudulent bills to Medicare. The federal investigation was coordinated with a number of states' Medicaid fraud control units. From the many examples of alleged facts in the DOJ's announcement, consider these. There was an indictment in a compounding pharmacy fraud case that alleges that an attorney/marketer paid kickbacks and offered incentives such as prostitutes and expensive meals to podiatrists in exchange for prescriptions written on pre-printed prescription pads, regardless of the medical need for the prescriptions. Once the prescriptions were filled, members of the conspiracy submitted approximately $250 million in fraudulent claims to federal, state, and private insurers for the compounded drugs. In another case, defendants are a pharmacy chain owner, managing partner, and lead pharmacist who are all charged with a drug and money laundering conspiracy. According to the indictment, the co-conspirators used fraudulent prescriptions to fill bulk orders for over 1 million pills of hydrocodone and oxycodone, which the pharmacy in turn sold to drug couriers for millions of bucks. A prosecution alleges that a home health fraud and kickback conspiracy that resulted in more than $6.2 million paid by Medicare based on fraudulent billings. A physician owner of a pain management clinic was charged with unlawfully prescribing more than 2 million dosage units of oxycodone. 12 defendants, including 5 medical professionals, were charged in various schemes involving healthcare fraud, unlawful distribution of controlled substances, aggravated identity theft, and money laundering. One of the schemes involved the operation of 2 false front medical clinics. The feds also announced that since this time last year, they excluded 2,700 individuals from participation in Medicare, Medicaid, and all other federal healthcare programs, of whom 587 were excluded for opioid diversion and abuse alone. Over the past fiscal year, the DOJ has won or negotiated over $2 billion in judgments and settlements related to matters alleging healthcare fraud. Hey, look, fraud's a big business, both for those engaged in it and for those investigating it and prosecuting it. Heck, with all that competition, the field's already crowded, so I suggest you go into a slightly different line of business.